Hi, good morning, everybody. Thank you for joining us this morning. Um, for those of you that have been with us, this is our fifth group meeting. And those of you that may not know who I am, my name is Chad Allgood. I'm the director for the Division of Early Childhood Care Development, and we are with the Mississippi Department of Human Services. A few weeks ago, we convened the two advisory councils. One, the advisory council that works with the Mississippi State Department of Health for child care licensing, um, and then the council that works with the Mississippi Department of Human Services, specifically our division on the child care payment program. And we met to discuss the regulatory language that is in the child care licensing requirements and the overall program, the overall licensing program. And we gave the two councils the opportunity, and we presented to them a prospective project where we would completely overhaul the child care regulations and the overall program itself. And so that's what we're doing. We're meeting to carry through with that project. And when we decided the way that we were going to approach the work, we discussed into three phases, which the councils agreed upon. And we're currently in phase one. The phase one is as we're rewriting regulatory language, we are ensuring that we are in compliance with the federal health and safety requirements. And so that's what we've been meeting. We've had 4 meetings thus far. Like I said, today is our 5th meeting. This meeting, we're going to focus on preventing sudden infant death syndrome, or SIDS, and the implementation of a safe sleep policy with our child care programs. Today, I am joined by Lakeisha Bland. So Lakeisha is the licensing liaison for my division, between my division and Department of Health. I'm also joined by Crystal Carter and Crystal Murphy, who are also members of my division that are assisting with this project. And then we're thankful to have Amy Page, who is our federal TA partners, and Amy and some of her other colleagues that are also our federal TA partners have been very gracious in joining us for these meetings to help guide the process and make sure that we are hitting those federal requirements when we're addressing this language. So again, Amy, big thank you to you for being here this morning. So before we get started, I just wanted to talk about a couple of things. One, some of you that this may be your first meeting, you may be wondering, why in the world is Department of Human Services involving themselves in child care licensing? So even though the Department of Human Services is not the licensing agency for the state of Mississippi, part of our state plan, which is required for us to receive the Child Care Development Fund money, which is most of the money that comes into Mississippi to support child care, there is a component about monitoring child care programs. And we, as the lead agency, are responsible for making sure that those activities take place. Also, we pay for the child care licensing program pretty much completely. So we do have a very vested interest in making sure that the licensing language is satisfactory, not only for the federal requirements, but also that the licensing language and the way that you all are monitored is working for you. We want the regulations, and one of our primary goals of this project, we want the regulations to make sense. We want them to be easy to understand. We want you all to be able to use them as a reference, just to make sure that you have guidance, and when you encounter things day to day. So we need to make sure that the regulations are documented as useful, which is also why we're giving the opportunity to weigh in directly on the language. So You're going to go today. We actually have a sudden infant death syndrome work group committee. So during the first part of the session today, as we're going through the rules specifically, we're only going to allow members of the work group committee to weigh in on at that particular time. Now, once we get to the end of that time frame, or we will have a public comment period. So those of you that are not on the work group specifically, but are joining us, whether you are work group members or advisory council members that are not part of this work group, or you are a member of the public, when we get to the public comment section, we will 100% give you time to speak up about anything that you see today, any comments, any suggestions that you may have, etc. So and we will let you know when we get to that portion. So really quickly, I'm going to do just a quick roll call of our SIDS and Safe Sleep work group members, just to make sure that everybody are here. So do we have Hope Jones? And you can confirm me present right here when I call your name.
Here.
Hey Hope, good morning. Good to see you this morning. Jamila Taylor. Don't see she won't join us after all. Marnisha Kathy.
Good morning.
Hi, Marnisha. Good to see you this morning. Or good to hear you this morning. And then from Department of Health, Christy Rowell.
Good morning, Dr. Allgood. I'm standing in for her today.
Hey, Tanya. Okay. All right. Thank you for joining us this morning. We appreciate it. Okay, so as I said, those members of the work group, when we get into what we're about to get into, they'll be giving their feedback, and then we will do the public comment period towards the end. So just another reminder, today, as we're going through this language, this is about coming up with solutions. Okay, we do acknowledge that work group members may have. We do want you to voice if there's been frustrations or pain points. But again, the ultimate goal with our work group, and for those of you that are joining as members of the public, the goal today is 100% about clarifying any language that needs to be clarified. It's about fixing anything that needs to be fixed. So again, I just appreciate you all so much for taking your time to join us today. I do feel like this is a very worthwhile endeavor, and it is one that we certainly could not complete successfully without your participation. So again, you have my gratitude as well as those from my division, and of course our federal TA partners. Thank you for taking this seriously and for being here and being present. And with that being said, Amy, I'm going to turn it over to you.
Great. Thanks so much. Can y'all hear me okay?
Yes.
Good morning, everyone. Like Ted said, my name is Amy Page. I'm really glad to be with you today. I'm with the Child Care Quality and Business Support Center, which is one of the federal TA partners, as he mentioned. And so we're really grateful to be working with Mississippi through this process. And want to just take a quick moment to go over kind of the flow of the meeting. He's mentioned a little bit. I'm going to do a short, just little introductory overview for CCDF requirements as well as today's particular topic. Give the work group committee some questions to consider when thinking about the rules and how they may be, want to think about reformatting and just general considerations for rule revisions. And then we'll go into the rule discussion, and Crystal will lead us through that part. We'll have a worksheet that we go through rule by rule to talk about the current existing rules that apply to safe sleep as it relates in the center based rules. And as Dr. Allgood mentioned, we'll have an opportunity at the end for public comments. So with that, we'll go ahead and just jump in and get started. You've heard a few times already this morning about the CCDF health and safety requirements. When we talk about the Child Care and Development Fund requirements specific to health and safety, we really think of it sometimes and fondly refer to it as a three-legged stool. So this diagram kind of loosely represents that first leg at the very top is related to standards or regulations, and that's really the development of standards based on the health and safety topics that the CCDF law outlines. as well as requirements for staff to be trained. So it's really your rules and your regulations related to the implementation of health and safety practices, as well as health and safety training. Down at the bottom left, you'll see the second leg is training. There are really two parts of that. There's, as it relates to CCDF, there's pre-service orientation training, which is required for all of the different health and safety topic areas. And then there's also ongoing training, which would be your annual training requirements that you're required to have for professional development. And then the third leg is the monitoring leg, and that's the piece where licensing then is charged with coming out and making sure that childcare providers are implementing the practices related to the health and safety standards, as well as reviewing documentation that the health and safety training and annual training is taking place. And so really for the purposes of today and for these work groups, we're really just focusing on that first leg of the stool, the actual rules and regulations. The health and safety topics themselves, there are 11 specific health and safety topics related to standards. And then for pre-service orientation training, CCDF requirements also add an additional one for child development, which will actually be one of the work groups for next week. But here you'll see the 11 primary ones that are related to the topics that regulations are developed around. And so again, just as a reminder, these are federal requirements the CCDF regulations are federal requirements, and then these health and safety topics were part of reauthorization. And the topics that you see here, of course, are the ones that really focus on ensuring the health, safety, and reducing morbidity in childcare. And so the things you would expect, like the prevention and control of infectious disease. Our topic today is actually highlighted here. It's topic 2, the prevention of sudden infant death syndrome, or SIDS, and safe sleep practices. Some of the additional topics are the administration of medication, food and allergic reactions, building and physical premises safety, shaken baby syndrome, emergency preparedness, safe storage of hazardous materials and appropriate disposal of biocontaminants, safe transporting of children, pediatric first aid and CPR, as well as recognition and reporting of child abuse and neglect. So all of the major health and safety topic areas. And so requirements for regulations need to speak to all of these different topic areas, and then training for pre-service and orientation, of course, includes all of these topic areas, as well as child development, like I mentioned earlier. And so I'm going to take a little closer look at today's topic. Again, it's prevention of sudden infant death syndrome, which we commonly refer to as SIDS, and the use of safe sleep practices. And, really just having standards in place, making sure that we can reduce and prevent sudden infant death syndrome, and making sure that childcare are using safe sleep practices is extremely important. Like I mentioned, the standards are really intended to reduce risk and to increase health and safety. And it's noted too that with respect to morbidity, 20% of SIDS deaths actually occur while children are in childcare. And so we want to note that, while we often hear about it related to children in their home, a good percentage of SIDS deaths unfortunately do occur in childcare settings. Something else to keep in mind too about the CCDF health and safety standards is that they are based on the ages of the children served. So for example, with this particular topic, if a program is school age only, then these infant safe sleep standards obviously wouldn't apply to them. They would apply to only the programs where the age range of the children in care apply. Okay. Some indicators for this particular topic, and we'll talk about this a little more specifically when we get into the regulations, but making sure that infants are placed on their backs to sleep. You probably remember years ago the Back to Sleep campaign that was predominant about making sure infants are placed into their cribs on their backs, using a tight fitted sheet only in the cribs and not having other things in the cribs such as pillows, soft toys, bumper pads, blankets, or comforters. Making sure that infants who fall asleep somewhere else, for example, in their car seat, are moved to their crib for sleep. And then also avoiding overheating and covering the infants' heads. Of course, this is, like I said, this is not an exhaustive list, but this is just some of the types of indicators that we think about primarily when we think about the safe sleep topic as it relates to childcare regulations. Specific to Mississippi, there's two sections of regulation that we'll kind of focus in on today with the specific regulations, and that is 1.9.4, which is rest periods, and then also 1.10.7, which relates to cribs. So the rules that we're going to discuss today will come from those two particular subchapters or sections of subchapters. Some questions to consider in general when thinking about changing of regulations or thinking about, how regulations are implemented is, do any of these regulations present any particular challenges to providers as written? Are they hard to meet? Are they hard to implement? Are there any ways that any of these rules could be simplified? Is there anything that is repetitive or could be combined? Another consideration is, are they hard to implement? Are there certain rules within this topic that you find difficult or struggle with making sure that compliance can be maintained? Clarity issues. Is there anything that you find confusing that could be written more clearly in what we refer to as kind of plain language and simplified? Also, suggestions for improvement. Do you have, any suggestions for rule changes to help ensure high quality care and reduce the burden on current providers, or any considerations for newer potential providers as it relates to this particular topic of regulations? And then any additional feedback. As Chad mentioned, we want to make sure that, if we find something difficult or hard, we want to come with solutions and think about suggestions or feedback to how to improve and make things easier to understand with the regulations. So with that, I'm going to pause for just a moment and just ask if there are any questions regarding the CCDF health and safety requirements or around this topic in general. Pause for a moment. No? Okay. So with that, we are going to move into our rule review discussion. And as I mentioned, Crystal's going to lead us through that. So let me end the slideshow so we can get up our working worksheet for today and share that. All right. Crystal, I will turn it over to you.
Thank you, Amy. All right. Good morning, everyone. My name is Crystal Carter, and I will be your facilitator for today's work group on sudden infant death syndrome and safe sleep. We will review each rule individually. As each rule is presented, we will pause for questions, comments, or suggestions for revisions. Are there any questions at this time?
No.
Let's begin. Item number 1, prevention of sudden infant death syndrome and use of safe sleeping practices. Rule 1.9.4, rest periods, page 32. 5, a safe sleep environment for infants to lower the risk of sudden infant death syndrome, SIDS, is required as follows. A, an infant shall be placed on his or her back for sleeping unless written physician orders to the contrary are in the child's record. Sleeping infants shall be within the view of the staff and visually checked regularly when sleeping. Nothing shall obstruct the view of the staff or prevent the staff from clearly seeing infants or children. Suggestion. This is a long rule. Consider breaking into 3 separate rules. Are there any questions, comments, or concern about this rule? Item number 2, Rule 1.9.45B. Infants shall be dressed in clothing appropriate for sleeping that is designed to keep the infant warm without the possible hazard of head covering or entrapment. The room shall be kept at a draft-free, seasonally appropriate temperature of 65 degrees Fahrenheit to 78 degrees Fahrenheit. If a child is already asleep and not dressed in clothing appropriate for sleeping, the caregiver does not need to awaken the infant to change his or her clothes. Suggestions. This is a long rule. Consider breaking into 3 separate rules. Are there any questions, comments, or concerns about this rule? Okay. Item number 3, Rule 1.9.45C. Facilities shall use a firm mattress covered by a fitted sheet. Are there any questions, comments, or concerns about the rule? Item number 4, Rule 1.9.45D. Items such as, but not limited to, pillows, blankets, sheepskins, bumpers, soft objects, stuffed toys, loose bedding, etc., shall not be in the crib. Are there any questions, comments, or concerns about the rule?
Do we need to add something about bibs or pacifiers?
So, because pacifiers, parents want to put them on those quilts. And some of those quilts have the long string. So if they have a passy, I don't believe they should be on a quilt while they are.
We might want to consider that then.
Or have a bib on because it can get tight around them too.
That's a good suggestion. Like you say, we have more details and examples, because again, you're right, they're not supposed to have the bibs or those pacifier holders, because those are choking hazards. So yeah, we can add those in there. Thank you.
Are there any more concerns about the rule? All right. Item number 5, Rule 1.10.7, cribs, page 32. Number 1, the facility shall provide a crib or other similar commercially purchased bed unit approved and designated for the purpose of sleeping. Mobile infants at a minimum of 8 months may be placed on a mat during the transition period of crawling to walking. If such mat is used, it shall be a flame retardant minimum of 2-inch commercially purchased sleep mat, especially designated for the purpose of sleeping. All cribs, sleep units, and mats must be maintained clean, in sanitary condition, and without chips, holes, fraying, tears, or stains. Note, this language is repeated in Rule 1.10.96 on page 38. Are there any questions, comments, or concerns about this rule?
Can someone give me an example of what would be an other similar commercially purchased bed unit? Do we know what that is?
I think that's a
Would
good,
it be like the ones from Lake Shore?
yeah, I think that's a good question. I think we need to explain it, on that. I think that is certainly a vague descriptor.
If it's helpful, I can kind of do some research and get some examples of other terminology from regulations for that as well.
Yeah.
That would be helpful. Thank you, Amy.
Sure.
Okay. Are there any more concerns about the rule?
This is Debbie. Shall I wait for public comment or do I need to jump in now?
Debbie, we'll let you go ahead and say something.
We had a discussion about the thickness of nap pads at one point. And I'm seeing here that they're requiring a 2-inch commercially purchased sleep mat. Again, I looked up the rationale for 2 and 3-inch mats, and it basically boiled down to the princess and the pea. If there's a bump or something in the floor, they'd be less likely to feel it. So I would just say place them on a nap mat or a mat provided for nap time, and not get into the inches, because that's going to conflict with what we said before for nap time mats.
Yeah, I think we just need to ensure that it's firm, whatever the surface is. That's the biggest deterrent from SIDS. It's when infants sink down, or their head is out of alignment. If there's any possibility that their neck and their head are not in alignment. So I think we could remove the inch requirement, but I do think we need to make sure that we specify that it is a firm sleeping surface to make sure that the head and neck is in alignment, because that's when we get into problems.
And
But you wouldn't want to put them on one that's just completely blown out, but it will conflict with what was determined for older children. Now, for infants, you may leave it like this, but let me say, those 3-inch mats, it creeps up from 2 inches to 3 inches. You could actually buy a mattress for what you can pay for one of those mats. So you may as well just put the mattress on the floor. It's ridiculous. It's just the case of the princess and the pea. They might be more comfortable. That's what it says. Now I can see for infants it needs to be firm.
And it says mobile infants at a minimum of 8 months may be placed on a mat during the transition time. Again, I think that as long as the mat is suited for nap time, and I think we could specify that it is suited for the purpose of sleep. I don't think the inch requirement would necessarily have to be in there.
That's great.
I have a question on that, because I've had it from other centers that ask me when going over this. Some centers have the cot. So are they going to be able to use those for their 8-month-olds? Because they use them for 1 year and up.
I mean, again, as long as it is, for an 8-month and up, as long as it is suited for sleeping purposes and the infant is properly, placed on that, I don't see any problems with it. Again, the issue is when infants are placed, when their airway is potentially restricted because of positioning, or when bedding is over their face, their mouth. That's when we run into issues. But as long as it is equipment that is suited for the purpose of sleeping, I mean, whatever that equipment is, again, as long as it is firm and does not interfere with those other elements of safe sleep, I don't see an issue with that.
Also, again, so when they are on a sleeping mat or cot, they're still not to have any covering.
I would no, not for this age category.
Okay.
No.
So we might need to maybe reiterate that when they transition to a cot or a sleeping mat, because I know that's a common practice.
I think that's a good point. And y'all, this is something that is I feel very passionately about. I actually had to witness the death of a 7-month-old because the child was placed in a very improper sleeping position. So, the baby was placed on their stomach on a thick comforter that was on the floor. And you could see the baby struggle to get upright to breathe. And his little arms and legs, he just couldn't support himself and he suffocated. So I think that's good. I think that's a good thing. We need to iterate maybe here again, that covering is not appropriate. And this was via video. Okay, via video footage. I had to watch this. So we can't I feel like we cannot emphasize enough why safe sleep is important. And I think you're right. I think some people, and it's not intentional, but I think people just don't really think through. When we think about sleep, we want a comfortable space. We want a blanket, and we want, we think, like a stuffed animal and everything. But there are factors that people don't necessarily take into consideration, and nobody wants the death of an infant on their conscience.
Item number 6, Rule 1.10.7, number 2, the use of stackable cribs is prohibited. Are there any questions, comments, or concerns about the rule?
We probably need to reiterate what a stackable crib is and what it is not. I think some of these descriptions are based on, certain types of products that were available at the time that it was written. And I would even say as some guidance, maybe provide, I don't know if it'd be possible to provide photos or links to something. I think just again, the more that we can illustrate what we're talking about and why, I think that's important.
Thank you, Chad.
Because I'll be honest, I don't even know what a stackable crib is myself.
They literally stack on top of each other.
Well, I mean, I think
They can fall into each other.
yeah, I figured they were definitely stacked on top of each other, but I wouldn't even know, like, I mean, is that something that you like? If you go to buy one, do you actually like Google stackable crib to purchase? Like that's.
So
Chad,
they're
you're too young to remember. This goes way back to probably early 2000s. But you used to be there were child care facilities that had 3 levels of cribs across one wall. They were honestly, they were stackable. They looked like cages, and it was awful, but it was allowed at that time. But I think that's what this stems from. Then they call them stackable cribs.
Kind of like cubby
But
holes for babies. Like
yes, you wouldn't have believed it.
okay.
Miss
Okay.
Debbie, did they have like the little drop sides so it would flip down where you could, reach in and yeah.
Yes, but you had to reach in there like you were at the, animal shelter and pull them out. They were literally stacked 3 high, and maybe 3 or 4 across. They look like cages.
Yeah. So someone just sent me a photo. Anna just sent me a photo. Okay, I see. Yeah, those are wow. Yeah, Debbie, you're not lying. That looks like you when you go to an animal shelter. And...
Yep.
Wow. Okay. Okay. I learned something today.
You did, and see, I never even liked the looks of them, but there was one facility here in Greenwood that had them stacked across a wall. It was shocking at first to see. There'd be no standing up in that bed.
Yeah.
Are there any more questions or comments about the rule?
Not about the rule, but I do like the idea of being able to provide pictures and links if that's at all possible for any of the things from a firm mattress to what's an appropriate or inappropriate cot or mat. If we can, I think that would be very helpful.
Thank you, Ms. Kathy. Okay, so at this time, are there any work group members who would like to make a final comment or offer additional suggestions regarding today's discussion? All right, we will now open the floor for public comment. If you would like to speak, please raise your hand. We will recognize speakers in the order in which hands are raised.
Or if you don't know how to raise your hand, you can put your name in the comments.
Okay, I don't see any names or hands raised. So this concludes today's work group session on sudden infant death syndrome and safe sleep. Thank you all for your participation, engagement, and valuable input. The notes and recommendations for today's discussion will be reviewed and considered as we continue the rule revision process. We look forward to continuing this work at our next session. Thank you all and have a great day.
Thanks, everyone.
Thank y'all.
Thank you.
Thank you.